Hello, everyone. My name is Megan Fidel, and I want to welcome you to today's webinar on public health and dementia. The Building Our Largest Dementia, or BOLD, Infrastructure for Alzheimer's Act marked a significant moment in the history of public health and policy nationwide. Passed into law in 2018, the Act expanded public health action and funding, not only at the federal level, but also in support of action in health departments across the country. We have two wonderful speakers who will be sharing their wisdom with us today. First, we have Dr. Lisa McGuire, who is the lead of the Alzheimer's disease program at the Centers for Disease Control and Prevention. Dr. McGuire has been a longtime expert and force in public health and Alzheimer's disease at the federal level, and among her many hats, oversees the BOLD centers and programs that we'll be learning about today. We also have my wonderful colleague, John Sheehan, Associate Director of the Healthy Brain Initiative at the Alzheimer's Association, who will be sharing information on public health tools you can use. By the end of today's webinar, you'll be able to explain the significance of the BOLD Act, describe the goals of the grants stemming from this legislation. You'll learn about some of the growing accomplishments by state and local health departments to advance work on dementia as a result of this funding. You'll also learn about where you can find resources and tools to inform your own work. Before we begin, we do have a quick poll that we'd like you to answer for us today so we can understand the audience. And while you're completing the poll, I'll also mention that this webinar is supported by the CDC as a part of a financial assistance award. The contents are those of the authors and do not necessarily represent the official views of the CDC or the US government. I also want to point out that today's webinar is purposely bite-sized, so we'll have about a half hour together today. And while we will have a few minutes of question and answer at the end, we also encourage you to reach out with any questions after the program. Okay. So I'm going to go ahead and pass it over to Dr. McGuire to take it away.
Thank you very much, Megan. Next slide, please. So today I'm going to talk a little bit about some of the initiatives that we have at CDC. So first, our initiative I'm going to talk about is the Healthy Brain Initiative. The purpose of the Healthy Brain Initiative was to advance public health as a central part of public health practice across the nation. Currently at CDC, we fund two different components of our National Healthy Brain Initiative Award. The first component, next slide, Megan. Component A, is awarded to the Alzheimer's Association, and component B is focused on populations with the highest disparities of related Alzheimer's disease and related dementias. So the awardees are focused on populations such as adults with intellectual and developmental disabilities, focused on other populations of race and ethnicity, such as African American adults, Hispanic adults, and American Indian and Alaskan Native adults. Next slide, please. So through the Healthy Brain Initiative, one of the major activities that we do is we develop the Roadmap series. Next slide, Megan, please. This slide shows the roadmaps that we have developed historically over time. So the first three that you see are for the state and local Healthy Brain Initiative Roadmap series, and these are the three that have been developed historically. The most current one is the nice lady looking off purposely, the African American woman with a larger size. This was released in 2018, and it provides 25 actions that are designed for state and public health to really, really promote brain health, address dementia across their jurisdiction, and to help support caregivers. The last one that you see here on the right-hand side, this is the roadmap for Indian country. So due to some of the distinctions and the differences between traditional state and local public health and public health as it exists in Indian country, we tailored and actually completely started from scratch when we developed that roadmap. And all of our roadmap series The actions are consistent with four of the 10 essential services of public health. Next slide, please. So this slide shows us who the recipients are. So component A is a large national organization that is working to implement strategies that are guided by the roadmap series, and will continue to develop and revise that roadmap series. And as I mentioned before, component B organizations support populations with high burden of ADRD. Next slide, please. Here are some of the highlights that we've seen in the past 2 years from our Healthy Brain Initiative component A's. So one of the really neat activities that component A has going on is they host a collaborative, and the collaborative consists of the BOLD Public Health Centers of Excellence, which you'll hear about in a minute, and all the Healthy Brain Initiative awardees. And they come together and host webinar series and provide other educational and informative events together. You can see some of the other activities that have been the highlights of the Healthy Brain Initiative A. So next slide, please. So this slide shows some highlights of what the component B awardees have accomplished. So IA Squared has developed an online resource library, as well as a custom website that's designed for brain health related to American Indian and Alaskan Native adults. Us Against Alzheimer's, or US-A2, has produced a first of a kind product that is really, it's a practical guide on how to communicate brain health messages with Latino and African American communities. And then the third accomplishment we see here is from UIC, which works primarily with adults with intellectual and developmental disabilities. They've hosted a variety of Health Matters webinars in that webinar series, and they have developed some co-authored publications, and they've reached a lot of people. Next slide, please. So BOLD is Building Our Largest Dementia Infrastructure. BOLD consists of 3 components that you see represented here graphically. So the first is the establishment of Alzheimer's Centers of Excellence. The second is providing funding to health departments to develop a uniform public health infrastructure across the United States. And then the third component is to increase data analysis and timely reporting of that data. Next slide. So these are some of the priority areas that are identified within the legislation of BOLD, and also are priority areas for our program at CDC. So we really are wanting to build that public health infrastructure that allows us to make population level change with respect to early detection and diagnosis, preventable hospitalizations for people who have dementia, also care planning and care management for people who have dementia, and support for caregivers of individuals who have dementia. And the work at CDC is very focused on health disparities and with an equity lens, paying close attention to rural populations and also high burden populations. Next slide, please. So as I mentioned, the whole purpose of BOLD is to create that strong public health infrastructure for dementia and dementia caregiving. And it's really meant to use the Healthy Brain Initiative Roadmap series and those identified priority actions to get those implemented uniformly across the United States. And the way that we do that in CDC is through our BOLD centers and our BOLD programs. Next slide, please. Okay, so this is identifying our BOLD centers of excellence. And we fund 3 BOLD centers of excellence, one on dementia caregiving, one on dementia risk reduction, and then the third one is on early detection of dementia, which you see the recipients listed here. Next slide. And here's some of the highlights. So one of the things that I want to mention is all of the BOLD Public Health Centers of Excellence will be hosting a national meeting to talk about the topic area that they focus on. So we can see here the early detection. They're soon going to be releasing their new website with a whole variety of extensive resources for early detection and diagnosis. And their national meeting is going to be held virtually. It'll be in October of 22. The Caregiving Public Health Center of Excellence is hosting their national meeting June 14th and June 15th in Minneapolis, Minnesota. And this meeting is going to highlight best practices and discussions with experts that elevate dementia caregiving as a public health issue and aim to encourage system improvements that will include and serve caregivers of persons for dementia. And then last but not least, the Risk Reduction Public Health Center of Excellence is hosting a workshop on social determinants of health at the Alzheimer's Association International Conference in July in San Diego. Next slide. The BOLD programs. CDC funded 23 BOLD programs at the core level and at the enhanced level. Those that were awarded at the core level, you can see listed here on the right-hand side of the slide. Those awarded at the core level were awarded at this level to develop an Alzheimer's plan for their jurisdiction and to form a coalition during that 3-year award. The enhanced awardees already had their coalitions in place, already had an Alzheimer's plan in place, and for their 3 years of the award, they were implementing strategies that they had identified in their jurisdictional plan. Next slide, please. You can see here are some of the highlights. So originally we had funded 16 BOLD programs, and with some additional funding from Congress, we were able to increase that number up to 23 at both the core and the enhanced level. So some of the other exciting things you see listed here is the Northwest Portland Area Indian Health Board, who's a core awardee. They worked with their tribal health boards to create the first draft of their first ever comprehensive dementia plan. We can see that Vermont, North Carolina, Oklahoma, Maine, they've completed updates to their plans that include at least 4 roadmap actions and their core awardees. Georgia, which is an enhanced awardee, they're partnering on the implementation of the Savvy Caregiver Program and Telesavvy program in areas of Georgia with high ADRD burden. Next slide, please. So in today's presentation, I highlighted a little bit about the Healthy Brain Initiative, which was to really develop and advance public health as a public health issue, brain health as a public health issue, versus BOLD. BOLD was to design to help public health build that public health infrastructure so we can be dementia ready for people who have dementia and also their caregivers. Next slide, please. So we see at CDC our Healthy Brain Initiative awardees and our BOLD program awardees all working together and all working together towards the same long-term goals, really to try to increase awareness and diagnosis of ADRD, making sure that people who are noticing changes in their memory talk with their healthcare provider about that. We're also working to reduce the number of preventable hospitalizations in people who do have dementia by utilizing the Medicare wellness visits, and also to make sure we are managing other comorbid chronic health conditions. And then the fourth goal is making sure that all of the Medicare benefits that are relevant are utilized. Next slide, please. So what's next for BOLD? So I can't give very many details, but I do want to say that in 2023, there will be another BOLD programs funding opportunity announcement. Please stay tuned. It should be available in very early 2023 with applications due in the spring of 23 and awards late summer of 2023. So thank you very much. And I'll turn it over to my colleague, John Sheehan.
Hi, everyone, and thank you so much, Dr. McGuire. One of the things that I love about the work that we do, and I've been doing this work for several years now, has been the excitement and the momentum, seeing the growth of the public health response to Alzheimer's, to caregiving, and to cognitive health. And it's exactly for the reasons that Dr. McGuire just outlined, taking the Healthy Brain Initiative, using that to advance public health, to advance brain health as public health issue, and now having the practical implementation and rollout through the Bold Infrastructure for Alzheimer's Act. So it's just a wonderful testament to the great work that public health practitioners are doing around the country. And I'm so pleased today to talk to you about how you can continue that work using the tools and resources that are available to you. Next slide. There are a lot of different resources out there, and I'm going to highlight just a few of them given our limited time today. We're going to cover 3 different buckets: data, guidance, and training. And I'll walk through each of these individual tools before telling you where you can find them. But just as a reminder, after today's webinar concludes, we will send out a link to the recording, a copy of the slide deck, as well as links to all of the tools and resources that we feature here today. So you'll be able to find those very easily. Next slide. First up is data. As we know, data drives action. Data is essential to our public health efforts. It is essential to our public policy efforts. And over the last 10 years or so, the population level data pool related to Alzheimer's, to cognitive health and caregiving has grown significantly. We, the public health community, we can call upon the power of data to really improve those population level health outcomes. There are certainly a growing number of data sources out there, but I do want to highlight today the behavioral risk factor surveillance system. Each year, each state can opt to collect state-specific data on cognitive decline and caregiving. And we at the Alzheimer's Association, as well as the Alzheimer's Disease Program at CDC, we then take that data and translate them into usable and easily digestible graphics and fact sheets. You can see screenshots of them up on your screen on the upper right-hand side. And we found that these tools are very helpful when making the public health case for risk reduction, for early detection, and for better supports of caregivers. I also want to highlight on the bottom half of the slide that you see here that the Alzheimer's Disease Program at CDC also uses that BRFSS data in their Healthy Aging data portal. If you visit the site, you can create customized reports and charts that are based on a variety of different measures of older adult health. It's very easy to use, and you can get really wonderful ready-made materials to incorporate into your public health efforts. Next slide. Guidance. This is our second bucket. Dr. McGuire already gave us a wonderful overview of the Healthy Brain Initiative Roadmap series. But here I want to highlight what we have in the second half of the screen here, the topic-specific focus. A lot of the issues that we've been working on collectively over the past 10 to 15 years fall into the bullets that you see on your screen: risk reduction, early detection and diagnosis, dementia caregiving, as well as workforce development, data, and surveillance. One of the emerging themes has been cross-cutting issues such as health equity and social determinants of health. And each of these topics, we've built out specific tools and resources to advance the public health response at the state, local, and tribal level. I won't go into too many details. We have a wide pool of resources and tools available, but you can see, and I know they're small, but you can see on your screen just a sampling of what some of these topic-specific tools actually look like. For instance, we have an action brief on hypertension as a risk reduction strategy for cognitive decline. We have how addressing the social determinants of health can help address Alzheimer's, as well as how to embed caregiving throughout an entire community to better support caregivers throughout a jurisdiction. Next slide. One thing that I found really beneficial in the work that I've done has been focusing in on state-specific actions. Here on the screen, there are state profiles that are available at the web address that you see below. And these include data, statistics pertinent to a specific state, spotlights of the public health action that have occurred in the state, as well as what are some strategic planning efforts around Alzheimer's that the state is undertaking. Each state profile you can find if you want to open a new tab on your screen right now. You can find each of your state profiles by going to alz.org/public-health/the state name. And if your state has two names, such as New York or South Carolina, be sure to put a dash between those two names too. But I encourage you to take a look to see what the top line data and statistics indicate, as well as where some public health action has been centered in your state. Next slide. The third bucket and the final bucket that I'll cover today is on training. The Alzheimer's Association and the Alzheimer's Disease Program at CDC, we jointly developed a training curriculum for public health students and practitioners. The public health currently has 4 modules that outline Alzheimer's as a public health issue, what the public health response must be to Alzheimer's, and how communities can work collaboratively on these issues. We'll actually have a forthcoming module on health equity and dementia that will be released later this year. So I encourage you to sign up for our newsletters, which I'll feature in just a minute, for updates and to be connected when when that module is released. Next slide. As promised, and as I've been talking through my short time today, on your screen is where you can find all of the tools, all of the resources that I featured today. And if you really just take away 2 things from my section of the presentation, please remember alz.org/public health and cdc.gov/aging. From these 2 sites, you can navigate and find all of those tools, all of the data, all of the resource mentioned today, as well as additional information, of course, about the Healthy Brain Initiative and about the BOLD Infrastructure for Alzheimer's Act. And on my final slide here, these are links to the specific newsletters. I do encourage you all to stay connected via our newsletters for the latest on Alzheimer's and public health news, information, and tools, as well as to stay updated on the Healthy Brain Initiative and BOLD. We are about ready to open it up for question and answer, and I do see quite a few questions have come in. But as a reminder, please use the Q&A box to submit any questions. And with our remaining time, we'll try to get to as many as we can. Megan, I'll turn it back to you.
Sure. So we had one come in. I think this is especially for Dr. McGuire. Are there any federal initiatives to encourage states to collect and appropriately publish dementia-related data to eliminate gaps such as Medicare Advantage claims data?
That's a really good question because as we see, more and more older adults are opting to participate in Medicare Advantage, and we're not finding their information included in the traditional CMS claims data or the Medicare claims data. Very recently, some of the Medicare Advantage claims data has been released. So it does allow you to be able to pick up those individuals who have chosen for some reason to use Medicare Advantage. So it is now available. It's not available immediately. So it'll be maybe a year or 2 old.
Thank you, Dr. McGuire. And this one I'll field to John. When the Alzheimer's Disease Association finds someone at risk, what do they do for the person?
Yeah, that's a wonderful question. And my first immediate thought is the Alzheimer's Association has a home office where Megan and I are located, helping coordinate efforts across a national level. But really where the heart and soul of the association lies is in our local chapter network. So when someone who is living with Alzheimer's or another dementia, when they are diagnosed or when they start to notice changes in their own memory and thinking, if they are connected with their local Alzheimer's Association chapter, we have lots of care and support programs, lots of educational opportunities for that individual, as well as for that individual's caregivers, family, and friends, to just understand what is happening with these changes in the brain, what might it mean for my future, and what can I do to prepare for what's ahead. So when someone is diagnosed and they connect with their local chapter at the Alzheimer's Association, we provide as much care and support and education to that individual and the ones around them in order to provide the best support that we can. And related to that, to help locate your local chapter, I'll put a handful of links, including the ones that I highlighted today in the chat. So give me just a minute to type those out, but I do encourage you to take a look through not only our website, but of course, cdc.gov/aging.
Thanks, Don. And we had a few questions come in about the PowerPoint and about links and the websites that were shared today. We absolutely will be sharing all of those after the program over the course of the next week. So you'll have access to all the materials that we provided you with today. We also have a question in the chat about a study that was mentioned on Alzheimer's and dementia and whether it's focused on minority communities. And I think that one is for Dr. McGuire.
Right. So most of the analysis that we do at CDC uses the behavioral risk factor surveillance system. And the behavioral risk factor surveillance system conducts interviews of about 450,000 people annually in the US. And it is it includes people of all race, ethnicity, urban, rural, etc. But with that data source, we are able to look at the results by race, ethnicity, geographical area. If someone's a veteran, we can look at it in a variety of different ways to get a picture of what's going on within the US population or within a specific state or geographical region.
Thank you. And we have time for just one more question, and I'll send this one to Dr. McGuire and to John. So this is a question about someone in the early stages of dementia. What's the best way to encourage them to get help, especially if they're struggling with accepting what's happening to them?
Well, that's a really challenging time for the person as well as their family members or their support network. I would make sure that if this was my loved one, that they have received a thorough diagnosis and a thorough workup, and that they also think about signing up for potentially some clinical trials that might be able to provide therapeutics or behavioral interventions that might be very useful to that person or the family. John?
Yeah, that's wonderful. And I would add on to that, getting support for, so if you are a family member or a potential caregiver to a person, getting support for yourself it goes a really long way. You know, it's a very difficult time, of course, for the person that is living with cognitive decline and cognitive impairment, but can be almost as taxing on caregivers and family members. So I do encourage that support network to seek support for themselves. And thank you to Jessica for reminding everyone about our 24-hour, 7-day-a-week helpline, 1-800-272-3900. This is staffed 24 hours a day that has trained clinician, clinical respondents who know who walk through this day in and day out, providing that support and that guidance for families that are encountering a dementianosis.
And just building on what John said too, I think for the families, it's getting the support and also getting some knowledge to understand a little bit about the disease process and what it is like over time and how it may not be just a singular straight trajectory. There may be good days, good hours, bad hours, just so that you can understand what's going on. And I know in my own family, my mother in the early stages, you tell her something that she said or she did, and she goes, I did not, I would never do that. So it's even hard during some of those periods of, higher cognition for the person who has the disease to realize or recognize that they're actually doing some of these things. So it's really, really challenging and very difficult for all involved.
Thank you so much to our speakers today for sharing their knowledge, and thank you to all of you who attended. We encourage any of you who attended today to please fill out our evaluation form. We'd love to get your feedback on future topics and how we can improve to make sure our material is relevant and helpful to all of you. So I included a link in the chat. We'll also send a follow-up email with that information as well. You'll also see our contact information on the screen. Please don't hesitate to reach out. And we encourage you to tap into the resources that we shared today at our website. So thank you very much, everyone. And that concludes our webinar for today.
Thank you, everybody.